I'm Dr. Larry Santora. Thank you for watching Heart Health at Home. Today I'm going to talk about inflammation and how the COVID virus affects your body in a unique way. When we get an infection, what happens is the virus or the bacteria enters the cell, in this case the cells of the lungs, the alveoli, which are the air sacs, and takes over the function of those cells in the air sacs and starts replicating itself. It destroys the air sacs or the cells that it occupies and then gives off various toxins. So early on with the COVID virus, an antiviral type of medication may work, but it also sets up an environment for a secondary infection, like a bacterial infection may enter at that time, and the bacterial infection has to be treated with antibiotics like azithromycin or other type of drugs. Then it may be taken in control at that time, or it may go on to a more advanced stage where it causes all this inflammation. Inflammation occurs when your body starts to attack the virus as part of the immune response. And part of that response is there are antibodies that come into the cell and they start to attack the virus, and they also start to, at times, damage your own lung cells. And part of the response are these various toxic chemicals that come in with the white blood cells, and they try and destroy the virus or the bacteria, but they also destroy your lung cells. When they destroy the lung cells become very leaky, and fluid tends to leak into the air sac and prevents the lungs from exchanging oxygen into the blood. And that's when patients have to be put on ventilators. That part of the treatment has to be treated with anti-inflammatory drugs like steroids or a drug like dexamethasone and other anti-inflammatory drugs. So when you hear the conflicting different responses to drugs, it's really what's going on at that time. If it's an infection, you need antiviral drugs, which are still not very robust at this time, and antibacterial drugs like antibiotics. But later on, you'll need some anti-inflammatory drugs. So that's why there's conflict with some of the response to some of these drugs that you hear. So you have to treat the virus early to protect from getting into the inflammatory response. So I think there's great progress being made. We're coming up with new drugs every day for inflammation, and there's a lot of old drugs that can be retried. But when you hear the conflicting reports, it's because we're dealing with infection or we're dealing with inflammation or both. Thank you for watching today. Next, my co-host Nikki Johnson, who is an expert in Medicare insurance, will come on next, and she'll be followed by Mary Sanchez, who's an expert in the real estate market. Thank you for watching, and subscribe with the subscribe button and send your comments to us, or you can email us at hearthealthhome@yahoo.com. Thank you for watching. Next week, we're going to talk about supplements that may prevent you from having adverse reaction to the COVID virus. And thank you again.
Hi, I'm Nikki Johnson, a health insurance agent specializing in Medicare. Medicare can be confusing, so I'm here to assist people with questions about Medicare and how to navigate the system. This can be when you're first turning 65, when you're retiring and coming off an employer plan, or even those people who have been on Medicare for many years but want to compare their current benefits and update their current plan. Today, I want to discuss Medicare Part A and B. Medicare is available to those turning 65 years old, those under 65 years old with certain permanent disabilities, and people of all ages with end-stage renal disease, kidney failure, or ALS. Medicare Part A is available premium-free through you or a spouse if you've worked in the U.S. and paid taxes for 10 years or 40 quarter credits. If you don't have enough credits, it is still available for a premium of up to $437 per month. Medicare Part A covers inpatient hospital stays, skilled nursing, home health care, and hospice. Medicare Part B comes with a monthly premium. In 2020, that monthly premium is $144.60. Now, your premium may be higher if you make over $85,000 filing single on your taxes or make over $170,000 filing jointly. Medicare Part B covers your doctor and specialist visits, your lab and x-rays, your outpatient procedures such as outpatient surgery, ER, and urgent care visits. Medicare Part A and B together are typically known as Original Medicare and will cover 80% of your Medicare approved medical bills. Therefore, it's always a good idea to join a private plan or at least look into them and see if it's right for you. This Original Medicare Part A and B does not include dental, vision, or hearing, nor does it include drugs or drug coverage, which I'll discuss next time. If you have any questions or concerns, please reach out to me via email, text, or call the number below listed on the screen. Thank you, and until next time.
Hello, my name is Mary Sanchez, and I specialize in residential real estate here in Orange County. I am with Coldwell Banker of Newport Beach. Welcome, and I hope you find today of value. So I'd like to share a little bit about what has transpired over these last several months and the shifts that are going on in our housing market since the start of February. So while there's no denying that the coronavirus pandemic has taken a toll on the real estate market here in Orange County, it has affected our entire nation. I'd like to share a quick recap of what has transpired over the past several months as it pertains to the housing supply. So we saw back in mid-February, buyers and sellers began to pull back as concerns of the coronavirus began to make headlines. Fast forward 2 months, we saw that the prediction of the slowdown coming to fruition. What's interesting to note was that while the sellers were taking a step back, a noticeable step back, the buyers were taking less of a slowdown and were very much so involved in continuing on purchasing the home and the properties that they were wanting to make offers on. So there was no slowdown with the buyer's interest. As we watched the closing and stats in March and April, it was very apparent that the prediction of the slowdown was in effect due to the shortage of housing supply. So coming into May, the buyers and seller market started to take an upswing. And there appeared to be a correction in the previous months. With this said, I'd like to share a few stats in our local market, starting with April and then into May. So in mid-April, there were 391 new listings placed on the multiple listing services, the MLS. In addition, there were 206 properties that went under contract status. This is a phase where the home is in escrow and the buyer is completing their investigations and their inspections and getting their loan approved. In addition, there were 91 properties that went into pending status and 331 properties that closed. Coming into mid-May, there were 532 new active listings placed on the MLS, 307 went under contract, and 111 properties went into pending status. And final closing for May was 276 properties. I was asked during this COVID and shelter place, how are we safely able to purchase a home during this time? Uncertain times. And I said very carefully and very safely. The California Association of Realtors put in place specific guidelines, which included virtual open houses and virtual tours. This allowed the interested buyers and sellers to view properties online from the comfort of their own home. And we are sure to see that this type of availability to be able to view properties from any time of the day from the comfort of your home is and will stay in place. So if you would like more information or have situations you would like to discuss based on your specific needs, please feel free to contact me. I'd be more than happy to help in any way. Again, thank you and be well.
Well, I want to thank you for watching the show today. I have a deal for you. I'm going to send a item that may save your life. Actually, 2 items that may save your life. So the first 50 people who write into our email address, hearthealthhome@yahoo.com. The first item is a book that I wrote called The OC Cure for Heart Disease. This, I think, has potential to save your life because it talks about the coronary calcium screening test on the electron beam CT scan. This is the single most important test, I believe, in medicine today. I wrote this book with NFL superstar Dick Butkus. It tells his story, and it tells you all about heart disease and how to utilize this very important test. I think you'll enjoy it, and it'll be yours for free. The second thing I'm going to give you that may save your life is this fantastic mask. I use this cloth mask instead of the paper ones, and it's very, very comfortable. You can talk with it. It doesn't smother you. It's not hot. It's washable. And frankly, it looks much better. And it also comes in different colors. Obviously, we can't give you the color that you want, but we will send you the book and a mask for the first 50 people who write in. So thank you very much for watching the show. We appreciate any comments that you may give us. Hopefully they're good comments, and we will see you next week. Thank you for watching. I'm Larry Santora, and this is Heart Health Home. Thank you.